Welcome to this week's episode of the Pet Loss Journals, and this week I will be sharing a very special guest with you, and I can't wait for all of you to listen to this episode. We are going to be talking about some really important things. I'm not going to wait any longer. I'm going to introduce my guest, Dr. Megan Anderson, and she is the veterinary surgeon, founder of Rainbow Bridge Veterinary Services in Ireland, which is the only hospice and palliative end-of-life care service that is in Ireland at the moment, and we're actually partnered up together, which is amazing. And this has been in the pipeline for a couple of months now, but we are delighted to be bringing our services together to help. Let's get going. Megan, let's start with Pip and how caring for Pip, was it in 2023, shaped your commitment to palliative and hospice care?
Yeah, thanks so much for having me on. It's lovely to be here. So I've been in first opinion practice, general practice, for about 10 years now, and I've always had a bit of a soft spot for the golden oldies, the grey muzzles, whatever you want to call them. And I suppose through PIP, kind of found that there was a bit of a gap in what we were providing, especially for patients that, yes, senior patients, older dogs and cats, but also any patient that has limited time left, regardless of how old they are, or any patient that has a medical condition that's really impacting their quality of life in ways beyond what medication alone can treat. There's this kind of whole patient, whole life, whole family approach that just is very difficult to kind of bridge the gap between what happens in a clinic, that conversation in a consult room, and what happens every day in between those consults. Yeah, 2 years ago now, we took on my partner's mother's dog. She ended up in hospital very unwell, and somebody just needed to kind of step up and mind him, because he was starting to get older. He'd been diagnosed with diabetes, and just generally, we all kind of knew he wasn't doing well. But until we actually, got to see him for the first time in a long time, and we didn't realise how unwell he really was. And I had a very blunt conversation, I suppose, with his family about the fact that realistically we weren't looking at long. I really only expect to survive, a couple of weeks, maybe, if that. And I just found, like, don't get me wrong, there's a lot of work and there's luck involved there too. It's not the case for every patient. But just giving him that whole body approach, treating not just his pain, not just his diabetes, but the psychology of having chronic disease, the emotional impact of having chronic disease, but also it really gave me first-hand insight to what we're asking of pet owners, how much work is involved. And I'm a 10 years qualified vet, and it's a lot for me, and I understand what's going on, and I have easy access compared to a lot of people, to medications, to resources, to information, and it just really highlighted to me how much we're asking of people, and there's no support for them to help them through it, to help them gauge what's happening with their pet, that you just can't cover in a 15-minute consultation.
Because before your service, they would just have to Google and research everything themselves, basically, if they wanted to learn about palliative hospice care, end of life. Yeah.
And that's first opinion. Vets, even referral practices, they do their best, within the confines and their time and resources. So it's very draining on them as well. They're trying to provide massive amounts of information and balance care needs for so many different conditions within, one pet, and then taking into account, what the client is able for emotionally, psychologically, their resources, financially, and they've got 15 minutes to do that. So it's a huge ask for a vet to do in a consult room in that setting. And it's a huge ask for a client to know all of this relevant information that they have to know to tell us because we don't know that their dog's favorite thing to do is to take a giant leap up onto the windowsill and just sit there all day and stare at things. And he hasn't been able to do that in 6 months.
Mm,
And he's sad because he can't do that.
mm,
But the client might know that there's something that we might be able to do to facilitate that. Maybe we need to look at a better pain management plan. Maybe we can provide ramps. Maybe we can provide other avenues of stimulation. Maybe there's access to a lower window,
mm,
things that we can do that are really simple. But as a pet owner coming in, they're not necessarily the kind of questions you're going to ask your
mm,
vet. You're going to ask them about what do I do about his medication? What do I do about his tummy
mm,
upset? Giving them a platform to kind of go, this is what's important.
mhm.
Because palliative care is about the person, not just the pet. It's the
Totally. I never
person
even knew
can't
that.
handle it.
Yeah.
Yeah, no, absolutely. Because if the family, whether it's financially, emotionally, psychologically, physically, if they don't have the resources to provide the care for their pet, then at the end of the day, the pet is the one who suffers.
Hmm.
And so we have to look at both.
Mm,
And I think it's really important. And that's where I think your aspect of things, the bereavement support, especially that anticipatory grief, that
mm,
fear, that knowledge that we're going to have to say goodbye,
mm,
and that's going to come sooner than we'd like. And
mhm,
having to still carry on providing that care
mm,
and, giving the insulin, assisted hand feeding on days that aren't great, lifting up and down, help getting in and outside, special beds, changes in routines, all these things. It's a lot.
mhm,
And if we're asking people to do all of that, and they want to do it, but they have to be in the headspace to do it. And
mhm,
that's a really hard thing to do alone. And
mm,
having somebody like your service where you can just lean on somebody to know that you've got that extra support
mhm,
of I'm struggling, you know, I'm struggling with what's coming. I'm struggling. I know I'm going to have to make a decision, or I don't think I can make a decision,
mhm,
or, I'm just what happens after? What am I going to do afterwards? And
mhm,
all of those worries that people are carrying. And if they're carrying that so heavily and bottling it up, they're going to burn out and they're going to regret how they spent emotionally, how they spent that last time with their pet. And I think it's
mhm.
really, really important that we can provide that for people as well.
Definitely. No, I couldn't agree more. So you describe your service as a kind of bridge between traditional vet clinics and the emotional, time-pressed needs of families. What gaps did you kind of originally notice in existing veterinary services before you kind of started Rainbow Bridge?
I think it's things like just people having the space to really voice their concerns. I think a lot of the time, especially with older pets or if they've got multiple conditions or complex diseases, we can get really focused, I think, in a consult room on an exam
Mhm,
and the detail of medically what's going on. And that has to be the case in to a certain extent because we've limited time and we've limited information. We don't see what's going on at home. We don't see the environment that the pet is living in. We don't get a feel for the amount of work, the burden that's on the family, the caregiver, families, owners of senior pets, of chronically ill pets, they are caregivers, they're doing the same work as somebody caring for an ill person. And they're trying to do it for a pet who can't verbally communicate their needs. So they're really relying on their vet to tell them, the common questions. is he in pain? Is he suffering? And we take the information that the client is able to provide, that they know to provide, which we're asking a lot of them to know what to tell us.
Mm-hmm.
Um, and then trying to, do this physical exam, pinpoint where is there pain, where is there, is there respiratory difficulty, is there cognitive decline? But we're not seeing the patient's sleep patterns. We're not seeing their ability to, enjoy their food. Are they eating? Yes. Are they enjoying it?
Mm.
Um, are they able to do the things that they loved specifically? We know a lot of dogs like to go for walks. That's great. But maybe your dog loved jumping in and splashing around with your daughter in the paddling pool in the summertime. And this summer couldn't do it and was visibly upset and sad and miserable, not able to do a certain activity that they loved being able to do. And trying to have all of those conversations in the context of a consult room in
Mm.
15 minutes is really difficult.
Mm.
Um, and by the time we've gotten through, okay, here are the symptoms that you're seeing at home. Here's the medication that you're currently giving. Here's what's going on in a physical exam. Here's what we can do with medication adjustments. Our 15 minutes is up and I need to see another patient.
Mm.
So I'm going to have you come back to me in another 2 weeks or whatever interval for a follow-up.
Mm.
But that's another vet visit, first of all, which might be difficult. Maybe you've got a Newfoundland who finds it really difficult with
Mm.
progressive arthritis to get into the car in the first place.
Mm.
Maybe you're a pet owner who's in their 70s and can't drive, during certain hours, can't get in a car in the evenings or is
Mm.
relying on somebody else for transport. And another vet visit for 15 minutes is really difficult.
Mhm.
And that's a real challenge, I think, to be able to take all of those things into consideration.
Mhm.
And if you don't have those bits and pieces, you can't provide um, that broader spectrum
Mm.
of care for your patient.
Mhm.
But I think also trying to be mindful that actually we're not doing the most of the caregiving. It's the families.
Mm.
We're telling them how to do it, but
Mm.
it's not us doing it.
Mm.
They're the ones doing the work all the time.
Mhm.
And
It's
they
very
rely.
refreshing to hear a vet say that as well
But they
because yeah,
do.
yeah.
They do. Like when I look at as Pip's vet
Mm.
and Pip's family and
Mm.
Pip's primary caregiver, the amount of time, if you break it down
Mm.
into how much time I spend examining him as a vet
Mhm.
versus the amount of time I spend caring for him as his family,
Mm.
the vet part is nothing. It's nothing.
Nothing.
It's so insignificant,
It's a drop in the ocean. Yeah.
Yeah, compared to all the time that you spend, you know, with his pain management, getting his tablets into him. He's got dry eye, so he needs, 3 sets of eye drops twice a day. He's got his pain medication, his insulin, trying to
Mm.
make sure that he's eating at the proper intervals, making
Mm.
sure he loves to lie on the cold floor and feel sorry for himself and shiver very pathetically. When he's doing that, he's looking for a cuddle, really. Has he got his jumper on? Is he comfortable?
Mm.
Does he need a bit of help getting up because his joints are very stiff? When he's outside,
The
have he
list
got
is
turned
endless, like.
around? Has he got stuck somewhere? And the
Mm.
limitations. There's a lot
Mm.
of things that I don't do, that I don't go to because I'd
Mm.
rather, on one hand, I would rather spend it with you. Sometimes it's a good excuse if you're looking to get out of awkward conversations or
Yeah.
the person in the pub who won't stop talking.
Yeah.
But also there are things that I would like to do that I
Mm.
don't
Mm. It's
because
relevant to say that
we
too. Yeah.
can't. Yeah, we choose not to go abroad for the
Mm.
last 2 years because he wouldn't cope.
Mm.
And I know I would never forgive myself if I left and that sent him over the edge and he
Mm.
didn't recover.
Mm.
Um, and those things are important. How do you talk about that in a consult room with your vet? You
And
know?
like even the mental state, the mental health of
Yeah.
pets, like that probably isn't mentioned much in
A lot of
consultations
people still
either.
don't know that cognitive dysfunction, essentially dementia, is really common.
Mm.
From 11 years old is the average age of onset.
Mm.
It's really, really common. And even a lot of people that are aware of it
Mm.
don't know that there are treatment options. There are things we can try.
Mm.
There are tools that we can assess, um, but it can be very disruptive to your
Mm.
routines, to your own life,
Mm.
and very upsetting because you're seeing that decline. A lot of people have family members, parents, grandparents who've been through dementia or Alzheimer's, and they're seeing these symptoms develop in their pet, and it
Mm.
can be very emotionally traumatic for people as well.
Mm.
And that can be a big part of where they really need support because they've seen how this disease can progress and they've seen how severely it can impact quality of life. They
Mm.
might be afraid to discuss those things with their vet because they're worried that there's nothing that can be done or
Mm.
that their vet is going to just say, oh, well, this is only going to get worse. If you're not coping now, you have to just put him to sleep, you
Mm.
know?
Yeah.
And it's very hard, I think, for a person to open up about that kind of stuff in a 15-minute consult room.
Oh, of course. And like even the words like hospice care and palliative care, like how do you explain, especially say to pet owners listening now, like the nuanced like difference between those two, like in practical
Yeah.
terms, so that anyone listening who is like maybe has a pet that's elderly is trying to distinguish between how do I know if I need this support and how would you explain that?
I think the first thing is if your pet has any chronic illness,
Hmm.
whether it's diabetes or arthritis or cognitive dysfunction or a cardiac condition, um, there's always, there's always something that we can do to help improve quality of life. Um, and sometimes that is as simple as helping the client understand in a little bit more detail what to expect. And that's where I say it's about the client as much as it is about the pet.
Hmm.
And helping to identify what their pet is struggling with because of their disease. And it doesn't have to be something terminal. Diabetes for most dogs is not a terminal illness. It's chronic, it's something they're going to live with forever, but it's a very treatable disease. Um, that doesn't mean that you can't seek palliative support because
Hmm.
palliation has this, I suppose, this association with, we always think of it as a cancer patient has gone for palliative care. It
Hmm.
has this connotation of we've given up. We're
Hmm.
abandoning all curative intent
Hmm.
and we're now moving to palliative care and we're essentially waiting to die.
Hmm.
And that's not what palliative means. Palliative means palliating, alleviating symptoms, managing symptoms, so the quality of life is improved despite an illness that we can't fix. So arthritis we can't cure, diabetes we can't cure. We can manage them and we can use things like diet, like routine, exercise, medications to help manage symptoms. Um, but the goal of palliation is quality of life, despite the illness, to alleviate the symptoms.
Hmm.
And even in cases where it is something that is potentially a terminal condition, palliative care still absolutely has a place there.
Hmm.
But we know from human studies that patients that receive palliative care, which is symptom management and quality of life, rather than focusing primarily on disease treatment, in conjunction with the traditional medical drug pharmaceutical based approach, they did much better in terms of their happiness and their comfort. Their quality of life was much better if they
Mm.
received palliative care early when they were first diagnosed, and they lived longer. Not because the medical intervention was different,
Mm.
not because they received more aggressive treatment, but because they were more comfortable. Their
Ah.
quality of life was better, and their life naturally extended because of that. Like, that's an amazing
That
thing.
can tell us so much about how it can benefit a pet's life, you know.
Yeah.
Unbelievable.
Yeah. So it's not goal, it's
Mm.
not prolonging life,
Mm.
but sometimes that's the result, you
Mhm.
know?
And then
Um,
hospice care then is, explain
yeah.
to us a bit about that then.
Hospice is more where we tend to hear the word palliative,
Yes.
probably misused.
Hmm.
Really, what we're talking about is hospice care.
Mm.
And it is a step up, and we are anticipating that this pet is likely to pass away from their disease in the near future.
Hmm.
In people, that tends to have a time frame of 6 months. It's not a defined time frame in veterinary. Palliative and hospice care in veterinary medicine is a fairly new field. It's less than 20 years old in terms of existing as a focused area of practice.
Hmm.
Um, so we don't have quite the same level of defined
Hmm.
timeframes. Um, Realistically, we're probably looking at something similar. 3 to 6 months tends to be the time frame to start thinking about hospice care.
Hmm.
And it is just that kind of next step, and really where bereavement support, addressing that anticipatory grief, that caregiver burden, because the amount of work and the amount of worry and the amount of fear really tends to be a lot higher because
Hmm.
people are, understandably concerned that, this decision, for most people, will be a decision to put their pet to sleep.
Hmm.
Um, that euthanasia decision really looms over them,
Hmm.
which I totally understand.
Hmm.
I experience it as well, and
Hmm.
I dread the day.
Hmm.
Um, I suppose
Yeah.
I'm familiar with it. I have
Hmm.
that advantage, and so I can only imagine me in my situation with Pip, with the level of experience I have and the knowledge I have
Knowledge. Mm.
around quality of life, around hospice care, about, the resources and when we've exhausted those resources, and I struggle with it.
Mm.
I can only imagine how other people feel
Mm.
about it. So that's really where the bereavement support kind of steps in there
Mm.
as well. But it becomes really about making sure that that last bit of time is as good as we can make it, but it's
Mhm.
also where we start end of life planning.
Yes.
So things like really focusing on quality of life assessment,
Mm.
using, subjective, opinions, but also some clinical metrics,
Mm.
actually putting numbers on it, giving
Mm.
scores to
Yeah.
actively track trends,
Mm.
really having in-depth conversations about the areas where this pet's quality of life is likely to really start to
Mm.
deteriorate, and at what point we need to look at making a decision.
Mm.
Um, or for some people, really they just don't feel comfortable with the idea of euthanasia. Um, certain religions, personal beliefs, past experiences.
Mhm.
And so for some people, it becomes a conversation about actually, can we facilitate a natural death?
Mm.
Which again is something that is really not talked about.
Mm.
Especially in Ireland, it's not really talked about.
Mm.
I know that it certainly happens,
Mm.
and many pets absolutely can have a very peaceful, natural passing.
Mm. And
Um,
that's definitely another episode that we could delve
oh,
into,
100%.
definitely,
Very
because I would
complicated.
love to dedicate an episode just to that, because I've had lots of guests on, and you're the first person who has mentioned that. So I can imagine a lot of people would be intrigued and interested for you to delve into that. So we'll definitely have you on again
Yeah.
for
Yeah.
to
And
delve in further. Yeah, yeah.
I'd love that. I think it's something that,
Mm,
like so many things, if you don't talk about it, it
mm,
just kind of gets swept under the rug.
mm,
And people are, again, in that 15-minute consult,
mm,
very difficult for people to raise the topic of
mm,
what if I don't want euthanasia? What if
mm,
I'm afraid of euthanasia? What
mhm,
if I have a personal or religious belief against euthanasia?
mm,
Um, those people, like when I would see them in general practice, they just kind of disappear from your radar.
mhm,
They're afraid to raise the topic because they're afraid of being judged,
mm,
which I understand.
mm,
They're afraid of being pressured into euthanasia.
mm,
And they find the easiest way to cope with that situation is to retreat.
mm,
And their pet stops receiving some of the care, some of the medication that they need, and we just kind of lose them,
mm,
which I think is really sad.
mhm,
So yeah, I think that would be a great topic to
mm.
cover,
Me
because
too.
it's definitely something that's not talked about,
Mhm.
and should be, because
Oh,
it's a
definitely.
valid option for
Yeah,
some pets.
totally.
Not all, it's not right for all pets and
Yeah.
it's not right for all families, but yeah, it's definitely an option.
Hmm.
And if it's something that people are interested in, that's part of where, we would start that conversation as we're entering hospice care,
Hmm.
so that people have time to think about what
Hmm.
that might look like for their pet, what that might involve for
Hmm.
them, or euthanasia, what that might look
Hmm.
like.
Yeah. And Megan, you offer gentle home euthanasia, and
Yeah.
just we had a conversation prior to recording before, and offering euthanasia at home with sedation first is a powerful approach. And personally, in my experience, I did have a vet come to do home euthanasia, but sedation was not administered, and I had no idea that that could have been an option. And I think that opened my eyes. And maybe a lot of people listening might think, "How did you not know that, Louise?" But like honestly, and I was a pet owner for years and I didn't. So can you walk us through what makes gentle euthanasia unique and why it can be so meaningful for families?
Yeah.
Yeah.
I think first of all, you're not alone.
Mm,
I think it's not something that you should be expected to know. You are the pet owner. You're not the vet. You shouldn't have to carry that burden of
mm,
knowing what is the best, kindest, least stressful way for your pet to pass. Your job is to be there and to love them,
mm,
and to be with them, and not have to worry about the rest of it. That's our job. And certainly for a very long time, not just in Ireland, in other countries as well, sedation was not the traditional approach.
mm,
And some of that, in years gone by, there'd be a number of factors. It may have been the availability of some medications. It may have been just experience and training of the individual vet. It's some of it is to do with what we understand about the process of death and how pets experience it. So like every field of medicine, it's a lot has changed.
mm,
But sedation, I think it makes a massive difference for everybody. I think, yeah, and to the point where I've had actually quite a lot of clients specifically check in to say, do you sedate? You do give sedation first. Can you give sedation first? Because they've had an upsetting experience in the
mm,
past and they're looking for something that will ease that for them and for their pet.
mm,
So essentially, what we're doing is allowing the pet to relax. And that, how we do that might be different for each individual. For some pets who find, for example, that they've had so many injections and they've been really unwell and they've been poked and prodded with casters and pain meds and all sorts, and they're just really reactive to needles. maybe we arranged for that family to have an oral or a mucosal sedation on hand for when the time is coming, when they're making an appointment, so that their pet is relaxed and comfortable at home before I even arrive.
Mm-hmm.
Um,
I never knew that was even an option. Wow, it's
yeah,
amazing that you've mentioned that.
yeah.
Yeah.
And sometimes, for pets that are okay, the sedation we give is no more sore than a vaccine,
Yeah.
and better tolerated because
Mm.
they're not expecting a jab at home.
Mm.
They don't have that built up anticipation of, oh, I'm in the vets and I'm going to rattle with the nerves and
Mm.
somebody's going to inject me.
Yeah.
That worry isn't there. So
Mm.
most of them, they don't even notice the injection.
Mhm.
It's not any more sore, as I say, than a vaccine. But it allows them to just relax,
Mm.
to settle, to be calm, to be comfortable,
Mm.
and for their family to see that.
And have the time with
Yeah,
them, which is just what they
as
wouldn't
they
get in the
slowly
clinic.
relax.
Yeah.
Yeah, absolutely.
Mm.
And I think it really helps the amount of times a family says, something along the lines of, this is the most relaxed, this is the most comfortable he's looked in days or
Mm.
weeks or months. And I think that's such a nice memory to have, to
Mm.
be able to say, his last conscious moments were calm and were comfortable
Mm.
and were knowing that I was with him and that he was at home,
Mm.
with everybody that loved him.
Mm.
And I think it's really reassuring for people to have those few moments to process and
Mm.
to see their pet calm and not afraid
Mm.
and not in pain. And it
Mm.
just allows the family then as much time as they need.
Mhm.
And for some people, that's no time. That's the sedation has kicked in. I just want to let him go now. And
Mhm.
there's nothing wrong with that.
Mm.
That's probably most people, to be
Is
honest.
it? Okay. Yeah.
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 I think they see that they've been waiting. They've had this anticipation built up that this is coming.
Mm.
And most people, once they see their pet is relaxed with the sedation and calm and comfortable, they recognize, I think, seeing that difference in a
Mm.
pet in front of them, that they have that light bulb moment of sedated is the best they've been in how long.
Mhm.
I think trigger something in people's minds
Mm.
that this is the right decision. We're doing the right thing here because seeing him like this really highlights how unwell he's been.
Mm.
And a lot of people at that point are ready to proceed.
Mhm.
Some people want a bit more time. And the nice thing with the sedation is they can have it because their pet is calm and is relaxed and is not in pain. And if
Mm.
they need 5 minutes, if they need 25 minutes, they can have it, you know?
Mhm.
Um, and their pet can still sense them, can still smell them, is aware that they're with them,
Mhm.
but also quite groggy, quite sleepy, not worried about much at all. And sometimes that's an opportunity if people feel that they just need to step out, that
Mhm.
they just aren't prepared, they're not able to be there for the very last moment.
Mm.
And that's
That's
okay.
okay. Yeah.
Yeah, that's okay.
There's no
And that's
set
really
like way
hard
to
for
do it.
people to understand.
Mm.
Yeah.
And I
Uh,
think you've described it beautifully, really, and given people like an insight into how it can be, like the gentle home euthanasia, and even with your other services, like if if somebody was just thinking, I think I'd like to reach out to Megan, like they may not know exactly what questions they have for you, but if you
yeah.
were maybe to list three of the questions that maybe your first consultations would, and maybe explain the areas that you work in and how the consultations work, and you do home
Yeah.
visits and things. Just give us a little run through of
Yeah.
what that might look like for someone listening who is considering reaching out.
So I think you're never wrong to reach out. I
Hmm.
think if you're concerned about your pet's quality of life, you know them better than anybody. You know, you're seeing them every day. You know them inside out. And if you're concerned, it's for a reason. And I think in terms of, people knowing when to reach out, just do.
Hmm.
Um, it's it's not something that, you should feel concerned about. It's not a commitment. If it's just a question of, is this appropriate? Can you help me? I don't know what to do. I don't know how to handle this. I think you're never wrong to reach out if you're struggling to cope with managing your pet's care, or you're just not sure that you're doing everything right, or you just need some support or reassurance, all of those things, they're
Hmm.
all great reasons to reach out.
Hmm.
Um, Sometimes people are a bit concerned, how their own vet is going to perceive, me getting involved.
Okay.
Or is their vet going to be offended that they've reached out to me? Does that mean their vet is going to think that, they don't trust them or they're not happy? Um, I'm not a replacement. My service is not a replacement for your GP practice, for your primary vet. It's a complement. It's to try and supplement,
Hmm.
to take some of that burden away from your vet who maybe is struggling to kind of give you all the support that you need in that 15-minute consult, but also to make sure that you and your pet's whole lives, that your relationships, that your priorities are being prioritized in the way that you want and that they need, in a more comprehensive way. And that's not a replacement for your primary vet. It's something extra.
Hmm.
So nobody should feel worried or concerned or, afraid of causing upset or like they're committing to, this is now the beginning of the end.
Hmm.
Um, as far as the services, it's very tailored to the individual. It's all in the home because hospice care, palliative care, it just has to be in that environment to do it properly,
Hmm.
to really know, to get to know the family, to get to know the pet, to get to know their routines and their habits and what they're struggling with and what they're worried about. That has to be in a comfortable environment,
Hmm.
not a clinical cold consult room.
Hmm.
To see what the pet is doing when they're relaxed, when they're in their own home. That's totally different to seeing how a pet behaves in a clinic.
Hmm.
Um, so it's all in the home and to take all of that into consideration. Um, and in terms of what each pet needs, it's so different. It's so hard to compile everything
Hmm.
together into kind of one little synopsis, but it's really individual.
Hmm.
And it's customized for each patient and each family. Because what everybody needs is different. What
Hmm.
every pet needs is different. So it's something where I think it's not a one size fits all. We do this, we do this, we do this.
Hmm.
And that's kind of the beauty of it,
Hmm.
is that it's so flexible and tailored to the needs of each animal and each family.
Hmm.
So I think anybody can reach out if they think they might benefit or even just with questions.
Hmm.
Because it is new in this country.
Yeah, it's very
A
new.
lot of people are struggling to understand kind of exactly what the place of it is or what the purpose of it is. But it
There
is what
is
you want.
such a need. Yeah.
Yeah. And some people don't want the palliative care, they don't want the hospice care, they just want as calm and peaceful and as calm of a passing for their pet as we can offer them,
Hmm.
and for them to be considered and looked after in that process as well.
Hmm.
Um, Maybe because they've had a difficult experience, maybe because they've never experienced it.
Hmm.
and that's okay too, you
Mm.
know.
I think everything that you've described is just so needed because when I speak to so many clients, many of them tell me that they share like at the end of their pet's life, they've shared that I kept ringing the vet and I kept saying that there was this subtle change in the pet's personality, behavior, routine, or pain, and I
Mm.
feel like I'm bothering the vet. I feel like they think I'm being over the top, and this is something I've heard so much, and just now, as you've described all of the elements of your service, it's so clear to me that this is where your service fits in for all of those questions that
That's
they
it.
feel that it's too much or that I shouldn't be asking. And some people don't even bother asking because
Yeah.
they're too like afraid of
Yeah.
what they might say or judgment or think that they're being too much. But anybody is listening and they feel that like that their primary vet just is great, but just does not have that extra time or support to kind of offer, then this is something that is definitely a
Exactly.
service that's available. Yeah, yeah,
Exactly.
yeah, yeah.
It is, and that's exactly the gap that it's trying to fill.
Hmm.
To be that support for people, to give them those resources. I'm not a therapist, as
Hmm.
much as I certainly do my best to help with people. I'm
Hmm.
not a child psychologist. There are
Hmm.
limitations to what I can
Hmm.
do, but I try at least to give people some sense of validation
Hmm.
of what they're feeling and what they're worried about,
Hmm.
and that they feel that those things that are important to them are prioritized, even if
Hmm.
it's not exactly what the textbook tells us as clinicians we should be
Hmm.
prioritizing,
Hmm.
that those things still matter. Um,
It's
and
so evident that you are compassionate and you have a lot of empathy. And like anybody listening will, I'm sure, agree with me because just listening the whole way through, you have that care and for both the family members and the pet as a unit together. And I think that that's what's so special. And you're a rare gem that's out there. And I really, really feel that like
you're very kind.
oh, but like this service is one of a kind in Ireland and it's so needed and just that we can team up together and partner together to offer this incredible service to people that really, really need it because like pet loss support, bereavement support, grief education is not included in veterinary services in clinics in Ireland. And although I've tried my best to try to offer that alongside clinics, it's not happened. And I really feel that what we're doing is so special to offer that together. And I think it's just a beautiful combination. And I feel that like, if anybody has any specific questions for Megan or myself, like I will share all of Megan's details in the show notes, her contact details, her website, and how to contact her and everything. But Megan, if there is something that you wanted to leave the listener with, a gentle sentence or a small tip or advice about if they're looking to kind of go down the route of end of life, palliative hospice care, what would that be before we finish up?
Oh, no pressure.
The first thing that comes to your mind, maybe.
I think I think it's really not to be too terribly cliche, but it's that you're not alone.
Mm,
Um, there are so many people, myself included, that are going through that process of, providing difficult levels of care for a pet that they really so deeply love, that is so important to them. Um, the worry, the anticipation, the fear, the self-doubt. I experience self-doubt, am I doing the best? Am I doing the right things for my pet? Um, and that's normal. Um, and it's not anything to feel embarrassed or guilty about, that it's it's part of loving them.
mm,
And as difficult as it is, I think sometimes the kindest and the best thing we can do for them is to make sure that their last bit of time, whether that's their last few months, their last few hours, their last minutes, all we can do is give them as much love and as much comfort as we can. Um, and it's not easy. It's not easy because you love them so much.
Mm.
And the more you love them, the harder it is.
Yes.
And that's just the nature of it.
Yeah.
But as hard as it is, there's there's support, there's help out there. And you shouldn't have to feel that you're in it alone. Um, whether it's in the caregiving process, whether it's the decision-making process, whether it's the emotional challenges, whether it's the actual moments of saying goodbye, whether it's hours, days, weeks, months after a loss. It is really difficult for a lot of people, and that's okay.
Yeah. Beautifully said. Thank you so much. No, this has
Thank
been
you.
such an important conversation. We're obviously going to have you back on. We already know the next topic, so it's just a matter of scheduling it in. But
Yeah.
thank you so much for taking the
No,
time
thank you.
to sit down with me and we can see
No,
each
it's been
other.
lovely.
Yeah, and speak.
And thank you as I know we've kind of chatted before, but I think having that resource to be able to provide to people of here is somebody that's going to understand. Here is somebody who has the skill set and the life experience to know what you're going through, to really know. Um, Not just here's a card for a local counsellor down the road who may or may not be a dog person. I think it's really, really, really important that people have somebody for this particular struggle, and to be able to point them in the direction of somebody like yourself is it's really, really nice, and just
No, thank
invaluable
you.
for them. So
Thanks so much.
thank you. I'm really, really glad that we've managed to link up, and hopefully we'll set an example
Exactly. Yeah,
for other clinics to start being more mindful.
that's a lovely way to say it. Yeah, definitely. Thank you so much, Megan.
Thank you.
Thank you everyone for listening. And if you did like this episode, share it with somebody who you feel may need it or who may be struggling. And if you did like this episode, we would so love if you could rate it or write a little review wherever you listen to your podcasts. But until next time, take care.